Good morning, everybody. Happy Thursday. We have an amazing show for everybody today. What do we have, Krystal?
Indeed, we do. Lots of interesting stories that we are digging into this morning. So a major admission from the CDC about just how badly they screwed up coronavirus.
Yeah.
They are also now screwing up monkeypox, so clearly they didn't really learn their lessons from the first time, but pretty interesting to dig into their own analysis of what went wrong and what needs to change. We'll break all of that down for you. Also some new details about that search at Mar-a-Lago. Some reporting indicating that this has to do with Russiagate documents.
It always does, doesn't it?
Always comes back to Russiagate in the end, doesn't it? All things stem from there. So we'll talk to you about that reporting and everything that's going on there. Also, as we brought you yesterday, Liz Cheney was in fact defeated, really in quite a landslide in her state there of Wyoming. She is now floating a presidential run. And of course, we had many cringe takes from the media that we have to bring you as well. So some updates for you there. Also, Jared Kushner has a new book coming out. I know you guys are all very excited. And it is already being panned in spectacular fashion, like across the spectrum, from the right to the New York Times. Yeah. So it's we've got some details for you there as well. And Rachel Maddow's replacement, Alex Wagner, launched her show, official debut, had some teleprompter problems there at the front. And we have some updates for you in terms of the ratings. Also very excited. Bringing back a little panel action today. Ryan Grimm and Emily Jashinsky are going to join us remotely to break down some of the latest polls in the midterms, and we'll get a check from them on everything that they are looking at and thinking about. Before we jump into the show, live show.
Live show. Tickets on sale September 16th. I feel like I'm going to go mad selling these tickets. All right. Center Stage Theater, Atlanta, 16th of September, 7:30 p.m. Standard Time. We will be there on Friday. It's going to be a fun time. Everybody can come out. We'll have a great time. We'll have a great show for everybody. Go ahead and buy your tickets. Less than a month out. We are already planning travel, and we're finalizing some of the plans there for the show. So go ahead and buy those tickets. For the premium members, as we had discussed, we are going to be sending out those two things. Also, I'm aware of the fact that our email delivery system is not working as well as originally promised. We're working on that. Tell us today if it doesn't come faster. We're piloting a few different programs, and we're going to figure it out. Always paying attention to you guys. But let's go ahead and start with the show, and let's throw this up there on the screen from the CDC. So you guys might have seen that the CDC reversed direction, but I actually think in the context of what was announced yesterday, we are seeing a monumental self-assessment happening at our nation's major public health agency, which is that the director of the CDC, Rochelle Walensky, saying that the botched pandemic response is calling for a full-scale reorganization. Now, personally, I don't think that even goes far enough, but the fact that the public health authorities, some 26 months or so into the pandemic, are basically admitting that they dramatically screwed up both performance, messaging, so many different basic elements from the beginning all the way really up until today is remarkable. And they led an internal or a reorganization and assessment panel, Krystal, which was actually chaired by some people at the Department of Health and the CDC, with interviews of over 120 people inside and outside of the agency. And it is remarkable what even these people, like the government is the most immune thing to self-criticism and self-assessment. Even they're like, yeah, we screwed this one up pretty bad. And they're like, it's time for a major change to this agency. Some of the things that they point to is that they're going to have to undo many of their bureaucratic biases. But their second, and I think the most important, is they said we need to have very clear messaging. I love also, though, that they kind of blame the American people when they say this. So they said, quote, this is Dr. David Dowdy, he's an epidemiologist at the Johns Hopkins School. He says, messaging to the general public needs to be, quote, very clear, very simple, very straightforward. Culture is changing. We need it to change faster in terms of CDC. So he's basically blaming like pop culture and social media for, not reacting to what the CDC said in a timely manner, as if it wasn't the initial CDC messages themselves were at fault. But I think at a very high basic level, to have the nation's top public health agency admit to the American people, we screwed this up dramatically. I mean, they themselves are calling for a full-scale reorganization of their own agency, and we should push very, very hard to make sure that we see the correct things. But I mean, that is just, it took too long, but I mean, it's probably better than nothing. But at least they admit it.
I'm pretty surprised
Right.
that they had this level of self-assessment. And I mean, Dr. Walensky made some pretty direct comments. She told the agency, to be frank, we were responsible for some pretty dramatic, pretty public mistakes, from testing to data to communications. And we're going to go through a little reminder trip down memory lane what some of those were. But I think in the early days of the pandemic, they actually escaped a lot of scrutiny because Trump was screwing up so badly. And so there was a sense of like, oh my God, if we just had like a different guy in charge, then our public health agencies would be able to do what they do and what they're expert at. But as time wore on, it became clear that those bureaucracies were also completely failing, and in some really basic and very, very significant ways that threw off our response from the jump and also really diminished public trust. And that was as big of a problem as anything as we then moved into the vaccine phase and you had a large population say, we're just not really sure that your guidance is accurate after the things that we heard before. So the fact that they're acknowledging it, she speaks directly to unclear communication. She speaks to the fact that they at times would have data that would be useful for making decisions on things like booster shots that they were reluctant to release to the public. And the reason that they were reluctant to put it out there sooner was because the promotion system within the CDC was based much more on like how many academic papers you had published than on really protecting the public and doing your job in terms of a public health official. So the incentives were all screwed up. So people wanted to hold on to the data until they got their little paper published so that they could get, a gold star for that, rather than really having as their number one priority getting critical information out to the public. And that's one of the things that she spoke to the most was that the orientation of the agency was more about sort of like academia and research, and that was how you were promoted, than it was directed at being super responsive, being super fast, and serving the public. But, I think one of the things that we're going to talk about monkeypox in a little bit, but one of the biggest failures was on communications. I mean, Dr. Walensky herself was criticized for her communication style, and I think had to bring in a public speaking coach and media
which
training.
The government paid for.
Right. So, this reflects on her as well. But the fact that you had public health officials and continue to have public health officials who are uncomfortable just telling the public the truth because they're worried that the public can't handle the truth, that is a massive, massive issue. It's not your job to be managing the emotions and psychoanalyzing the American public. You have to trust that people can handle the unvarnished facts about what is going on, what the risk factors are, what the risk vectors are, and how you should respond. You have to trust the public to be able to handle the basic facts. Otherwise, you're going to end up with exactly the muddle that we had in coronavirus and that we also are seeing with monkeypox.
Yeah, and we put together a list. And so, look, I know everybody's got their own pet peeves, but what we wanted to try and focus on was the very, very early failures, pre-vaccine.
And the ones that are like totally indisputable.
Right. Indisputable, like beyond even the vaccination policy. I think first and foremost was we should all remember the very, very early days of the pandemic, whenever the coronavirus was ripping through China, Europe was having lockdowns, Italy, January of 2020. There was a lot of questions. There's like, what the hell is going on here? And one of the major ones on COVID was, does this spread via surfaces, via particles, aka leading to the whole wash your hands discussion, or is this an airborne transmitted virus? Now, the real questions surrounded that, and we will also remember that the Chinese lied to the WHO. Famous tweet, January of 2020, WHO says China data shows that this is not an airborne transmissible virus. I mean, who knows how many deaths that led to in the early days, and actually misguided public health messaging. We should remember, it took until May of 2021, mid-vaccination campaign, let's throw this up there on the screen, for the CDC to finally acknowledge airborne transmission. It took them a year and a half almost in order for them to actually update their official guidance. And the reason that I chose this one to start is that shows us, Krystal, a 16-month backlog as to when the data is clear as day, everybody knows it, to a final official guidance revisory. And imagine the level of bureaucratic mishap and more to acknowledge the most basic fact and truth about a virus, and then to have it be known to the general public, to be known to the medical community for hundreds of thousands of people, not only in this country, millions across the world, to be dead, for them to finally update their guidance. That was number one. That was one of the initial screw-ups.
Yeah.
Number two was the masks. I mean, this one we can beat to death, forever. Let's put this. Probably
this one to death,
frankly.
probably. But
let's throw this up there, right? This is the timeline from the LA Times on mask guidance. We should remember the U.S. Surgeon General at the very beginning of the pandemic in February of 2020 urged the U.S. public in all caps, quote, "Stop buying masks." This was up until May. So 2 months, actually really almost 3, of initial spread across this nation of coronavirus. You had the CDC and public health authorities all the way up to the top of the White House basically saying masks do not work. He said specifically, quote, "Masks are not effective in preventing general public from catching coronavirus. If healthcare providers can't get them to care for sick patients, it puts them and our community at risk." So hold on a second. If it's not effective at stopping, but then why do healthcare providers need them? Well, we later find out through an admission from Dr. Anthony Fauci, the reason why that this message was concocted was basically to stop Americans from buying masks and in order to keep the stock for public health. Here's what I've always said this, which is that if they had just been honest with the American people and been like, listen, we have a shortage. Please don't buy them. We need the N95s for our hospitals. I think people would have stood by that. And actually, I always point to myself. When that happened, I was like, yeah, I don't believe you. And I bought a bunch of N95s on Amazon. If somebody had told me, don't buy an N95 because healthcare, I absolutely wouldn't have purchased it.
Yeah.
But it was more out of distrust. I was like, I think this is bullshit.
Well, I mean, it didn't make sense. I remember us talking about it at the time. We're like, so why is it helpful in a public health setting,
right?
But it's not helpful in general? Like, this just really doesn't add up. And then I think why this one and why we do harp on this one so much is because it really demonstrates this problem of, rather than just doing their job and saying, here are the facts, here are the science, here's the risks, here's the studies that back it up, they tried to massage the emotions of the American public, tried to engineer the outcomes that they wanted, and were fearful that the public could not deal with the actual facts as they exist. And so, they have they actually admitted that this is what they were doing, that they were lying to you because they were worried you would go out and hog up all the masks, and then frontline healthcare workers who were in dire need of masks and who, were screwed over by our supply chain issues and the fact that stuff all came from China, that they would have what they need. So this is, to me, such a perfect crystallization of what they have continued to fail on. And even then, once we got the acknowledgement, okay, yeah, masks do work, and then we go in the other direction of, okay, you got to have masks everywhere, inside, outside.
Even if sometimes they don't work.
Schools, et cetera. Then there was a reluctance to acknowledge that certain masks are kind of useless and certain masks are better. I mean, there was always just a reluctance to be straight with the American people when there was a concern that it might lead to giving, skeptics a talking point, or it might lead to some outcome that the public health officials were fearful about. I understand it's a natural, human instinct to try to micromanage these things, but ultimately, that ain't your job. If society has a problem as a result of the accurate guidance that you give, we have to deal with that downstream. But up front, you have to trust this is a democracy. Grown-ups are going to behave in an adult way and take in this information in an accurate way. And I just, I think back to that time, Saagar, and how scary it was for everybody. I think about how much we were all just trying to figure out what the hell was going on and how to keep ourselves and our loved ones safe. And the fact that we did not feel that we had a reliable entity here that was just giving us what they actually knew in real time made it so much more difficult to sort through what was fact and what was fiction.
Absolutely. Tests is another one. Let's go and put this up there on the screen. People really forget this, but we did not have reliable testing in this country for several months. And even then, it took a while for PCR, government-provided tests, and then there was a lot of controversy even around the PCR, around the level of cycles, and what exactly they were running for, whether they were too sensitive or not. And part of the reason why is, again, total bureaucratic screw-up. Essentially what happened is that the CDC basically said, no, we're going to create our own test versus buying existing tests. So while Europe and many other countries had far better testing, immediate testing that was available to their general public and was able to lead to, more quarantines of the right people instead of having to quarantine or ask population-wide concerns, we didn't have that for several months. And that led to what? People just risked it. People basically didn't trust it anymore. Eventually led to the fact that at one point there was US companies making rapid tests for Europe, not for America. I harped on that so much at the time because it just shows you the bureaucratic nightmare of the FDA and the CDC not using their emergency authority in order to push these things through. So look, those are three egregious ones that we pointed to. And I know there are so many more. Lockdowns, the initial vax campaign. I could go on for the fact they covered up the obesity. It's so much of the risk factors more. But outside of the controversial realm, you cannot look at any of these three things, no matter where you fall on a spectrum of public health, and not say this is a colossal mistake. Colossal mistake.
How long did it take us before the U.S. government was able to send Americans tests?
What, a year and a half?
I mean, it didn't happen until under the Biden administration. I mean, it was forever. South Korea, which reported their first test within a day of us, a week later gave permission for their commercial labs to develop tests. Within 2 weeks, they were shipping thousands of test kits daily. And by mid-March, they were testing at a per capita rate 40 times higher than the U.S. And by the way, South Korea, I think, has been lauded for their early coronavirus response, much more effective than ours. But there were countries around the world, and not just developed nations. There were other poorer countries that were able to develop tests and get their tests to their population far faster than we were able to do. And of all the screw-ups, I mean, that may have been the most critical, because that meant in those early days, we were flying blind. We had no idea how far it had spread, where it was, where the hot spots were. People were getting sick at that time, and they had no idea whether they had it or not, which of course, was terrifying for them and also resulted in additional sickness and death. So this was one of the most sort of critical screw-ups at the very beginning. So listen, bottom line, good that they're doing this assessment now. This came from, an external group that came in and looked at what happened and tried to do an independent evaluation. Good that they're having some unvarnished talk about what needs to happen here and planning on a big reorganization and a big shake-up and moving it from this sort of laid-back academic setting to more of a urgent, we got to get this done, and it's in the interest of the public health, and that's what we're focused on, posture. Now we got to see if they're actually able to pull it off.
Unfortunately, we already know that's not the case with monkeypox. We're about to talk about that. And, even the leading from behind strategy continues. Let's put this up there, which is that you guys might have noticed, which is exactly a week ago. The CDC actually revised all of its guidance around COVID, lifting requirements to quarantine if exposed to the virus, de-emphasized screening people with no symptoms, updating COVID-19 protocols in schools, the effective test to stay strategy, and saying, well, COVID, it's here to stay. They say that I don't really think there's many state or local jurisdictions that are even feeling they're going to need to start making mandates. So they're abandoning a mandate strategy, abandoning the test to stay strategy, and saying, look, we just know that COVID is here to stay and we need to learn to live with it. I mean, look, people have been doing that for over a year. Some people in the South have been doing it for much longer than a year. And they just come out, the entire American people, this is why this is very bad, which is that states and localities had to make individual decisions based upon unclear data and popular guidance months before, some cases years before, the CDC was like, yeah, this is reality now. You should have it the opposite. The CDC, I think I use this example on steak. The CDC is like, yeah, you should cook a steak well done. And people are like, okay, thank you. I'm just not going to do that. And it's like, listen, thank you for telling me
they
that.
They have all kinds of guidance like that. Yeah.
Runny eggs. By the way, runny eggs are disgusting, in my opinion. Now, some people like it. Apparently, they even order them that way. I think it's gross.
You like the yolk all completely hardened?
100%.
That is nasty,
cooked to
Saagar.
it, almost burned on the
disgusting.
pan. I want to stick into the pan when I'm scraping it off. Look, I'm a weird guy. It is what it is. But more what I'm saying is, I'm actually following CDC guidance in that, but I don't go after it's like Eggs Benedict, right? Where you get the yolk.
Delicious.
Anyway, but that's every time you eat Eggs Benedict, you are violating CDC guidance. Whatever.
You know what is gross though is when the whites of the egg aren't cooked. Now that is nasty. But a runny yolk, that's life.
My point is, they tell you not to do it. People say, I'm just gonna do it. and I'm gonna live with
there's
the
actually a lot of guidance
Yeah.
for like pregnant ladies that also is really outdated, and like nobody in other countries are
Right.
like, what? You can't eat like certain types of cheese? What are you talking about?
Oh, really? I didn't know
Yeah.
about that. Oh,
Yeah, it's like
yeah.
soft cheeses. You're supposed to avoid deli meat. I mean, listen, there are like outside chances that this could be a problem for you. But I just want you guys to know I had 3 kids and I had all sorts of cheese and deli meat
There you
during
go.
the time, and it all worked out okay.
More is my point is, give the guidance. People can live their lives. It should be directional in the way that we see what it is. Okay, we understand that, and then we can live from there. Instead, people had to start living in all these disparate ways across the country. Some places have mask mandates, some places don't have mask mandates, more based upon, frankly, the paranoia of their population than the actual science. And then the scientists take months in order to catch up with the general public. It's just a complete and total failure. So I think this is a perfect way to end that CDC story, acknowledging the failure, but at the same time, continuing the bureaucratic failure.
Cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.